black nail on your nail. 5 causes of black toenails. Many runners area unit acquainted, read, only too familiar, with the black toenail. The condition involves bruising, blistering or injury at a lower place the nail from repetitive trauma, either of the highest of the shoe banging against the nail or the toe slamming into the tip of the shoe. It's most typically seen by marathoners and people coaching at particularly high intensity. Some even see it as a badge of honor, a lot of black nails, a lot of bad. Repetitive trauma. In severe cases, beneath the nail blisters will cause the nail to detach, either part or fully, from the nail plate. This method are often quite painful if the detachment is barely partial, warns Dr. Lori Weisenfeld, NYC sports chiropodist, explaining that after the nail totally separates from nail plate, it's formally dead and can never reattach. The great news concerning this, it's not painful. The unhealthy news, it will take a protracted time for a brand new nail to grow in, about a year for giant toenails and 3 to 6 months for smaller nails. In bound case, subungual hematoma. Dropping a significant object, say, a dumbbell, onto your foot will burst the blood vessels underneath your nail bed and cause blood to pool beneath, explains Weisenfeld. This kind of blackened nailed, clinically known as subungual hematoma, is particularly simple to ID, because fungal infections. Fungal infections, like athlete's foot, can unfold to your toenails and switch them reminder yellow, blue, green, brown, purple and black, explains Sutera. This zero in color is exclusive to flora, as is that the presence of subungual debris, a chalky white substance that lines the nail bed and sometimes carries a cool odor. If you think that you'll have ozimosis, head to your doc. He or she will clip and diagnosticate some of your nail to verify a designation. Treatment choices vary betting on the severity of the infection. Mild cases square measure typically addressed with topical medications, whereas a lot of aggressive funguses need oral medication or perhaps optical device treatment. Skin cancer. Here's one more reason to use sunscreen. Melanoma, the most serious type of skin cancer, can grow beneath your nail bed on the nail plate and cause physiological condition of the skin, explains Sutera. It's usually a slow and painless growth, that makes it particularly difficult to catch. One ominous sign, discoloration that extends on the far side the nail and onto the cuticle, says Weisenfeld. If you've had no incidents of trauma and your nail is slowly beginning to modification color, especially if that color goes on the far side you're nailed, you ought to get the picture tried by your doctor, she advises, adding that often pedicured patients ought to do a skin tone. Occasionally, dark discoloration of the nail bed is just a matter of skin tone. Sutera sees this most frequently in patients of color. There's skin beneath your toenails, and a bit like skin anyplace else on your body, the pigmentation will amend over time, she explains. Oftentimes this kind of discoloration is symmetrical and seen on multiple toes.